This conference will now be recorded.
Thank you.
Hi, this is Amy Wermeyer, and I'm going to talk a little bit about some of the overview of what we're going to talk about today, as well as a quick reminder and overview of the OneRx program and how you would go about implementing it before we get to our real experts who can talk about the details of what you would do on a day-to-day basis. So today we're going to demonstrate some workflow options for patient screening and triage. We're going to describe the REDCap options for data entry, discuss some lessons learned from Jeff Jacobson, our pilot participant, and discuss successes and barriers with your implementation.
Quickly, I just want to give everyone a quick update on the status of the project. So as of yesterday afternoon, there had been a total of 131 pharmacists that had registered for the OneRx education, either via the live sessions that were provided or via the online training. We have 46 pharmacies across the state that have enrolled and have completed 155 screenings. Some pieces of clinical information resulting from those screenings is that 7.1% of the screenings had an ORT of 8 or greater, identifying a potential risk for opioid use disorder. And then also within the pharmacist's assessments using the triage tool, 16.8% were identified with possible OUD red flags. 29% were identified at risk for overdose. 78.1% of those screened had the take-back program discussed with them. We have had almost 6% of screenings result in naloxone being dispensed. And the average time spent with a patient is just 5 minutes. So it's not taking a whole lot of time for these interventions to be completed.
So just a reminder about the OneRx workflow. This should look familiar to any of those who have completed the OneRx training either online or live. So a reminder, when you get a prescription for an opioid, that would be the point at which we would hope you would initiate the OneRx sort of workflow process. We've recommended that this occur with every opioid prescription that you receive in your pharmacy, although we might talk about some caveats to that in the Q&A portion. So the opioid prescription should trigger a screening of that patient, and the screening can take place either electronically by the patient scanning a QR code, using a mobile device that you have in your pharmacy, or using a personal computer that you have available in your pharmacy. So those would be the electronic options for screening. If you prefer to use a paper process, then the patient can fill out the patient intake form on a paper document and return that to you. And then your work as the pharmacist sort of evaluator begins to decide what that screening information tells you as to whether the patient is at risk for opioid misuse or accidental overdose or both. And then that helps to guide which interventions you'll employ with the patient in that encounter. Again, this should look familiar to any of you who have completed the training. This is just a sample of the process in its entirety, starting with the opioid prescription when you receive it, the patient intake form, what it looks like on the paper version, the scoring of the patient intake form according to the opioid risk tool scoring values. Again, if you choose to complete the electronic patient information entry process, then the opioid risk score will automatically pop up for you in REDCap. Once you have that opioid risk tool score, utilizing the triage tool to determine which interventions are necessary for you to provide with your patient, and documenting all this information in REDCap.
So we've talked about, Amy's mentioned REDCap a few times, and that's the online collection tool we're using for our data collection process. Everyone, once a pharmacy is enrolled in REDCap, should receive their login and access. REDCap can look confusing, and that's because it has a lot of features, but for all practical purposes, the core functions really boil down to two options under the data collection portion of the navigation menu on the left-hand side of your REDCap screen. If you are having patients complete the patient intake form electronically, you will click on the record status dashboard, which is circled there in a red circle, and to see the completed patient intake forms that need the outcomes worksheet completed. If you are using a paper process, all you need to do is click on the Add Edit Records to create a new record and enter your patient intake form and outcomes worksheet. So really, it just boils down to those two menu options to enter your data. The rest of the features there are additional reporting and tools to help you better understand the practice as you move along here. So with that quick overview of kind of the process and the data entry process, we now want to turn it over to Jeff Jacobson, who's been one of our pilot participants and has been doing some testing for us, just to share some of his lessons that he's learned so far as a participant in OneRx.
Hello, everyone. My name is Jeff. We started this process, I think, early part of September, and really started seeing patients in earnest here the end of September and into October. Some of the lessons we've learned with workflow, especially drop-off, we started by having patients just do the paper forms, and we quickly realized that having them fill that out at the drop-off area was not going to work. So with that, we got some clipboards and just had them go sit down, fill them out, and then they could bring them up, after they got done with them. We moved on to the electronic portion of it by getting an iPad, and that we found that, as you would expect, the age group, the younger generation prefers the iPad, the older generation prefers the paper. The electronic version really does speed things up as far as the pharmacist side of it, because it's all been entered for you into REDCap, so you just have to fill out your questions towards the end, and you can get through it a lot quicker. But the paper format really isn't that difficult either. It really is. REDCap is really pretty easy to navigate. So we had a few issues originally with that, like Jamie talked about, the side of the REDCap, where to click. But once you get into it, it really kind of is very smooth. They've set it up so that you can just have that up on your computer almost all the time. You do have to refresh once in a while, but it's very quick and easy. The patient response has been actually very positive. At first, I had concerns about having the patients have to put their name on it, and luckily the OneRx team said, yeah, I think that's a good idea, and it's turned out that there has been really no problems with that. The patients have not said any, had any negative response to that. They are at first maybe a little confused as to why we're doing it, but as soon as you explain it to them, and we've had a lot of good luck dispensing naloxone because of specifically of this program. We when you sit down and talk with people about it, about the program, and you've got the naloxone already there as a prescription, they're much more apt to take it than if you were just to mention it and say, hey, we've got this product, do you want it? So it's been really, really good. In fact, there's been a couple of our patients that have been with us forever. They've been opioid patients forever, and they're not going to change what they're taking because they are in pain. But we realized as a staff that we were really doing them a disservice because we had never even thought about it until we actually had them fill out this program, and they both ended up going home with naloxone. So it's been really good in that respect. Our staff has been very good as well at learning to look at it a little bit different way, learning to look at the patients a little bit differently. At first it's this us against them maybe response, and now you look at it more of we need to help people to understand that they may need naloxone on hand just in case. It's not because they are intentionally overusing it or anything like that, but just in case something bad were to happen. And then also to realize that they're struggling with, they could be struggling with a disease, and we need to help them as much as we can by showing them that there are counseling places in town that they can talk to and maybe get some help that way.
Thank you, Jeff. Those are some great lessons learned. I greatly appreciate that. So with that quick introduction, we would now like to move into the real guts of a coaching call, which is the ability to answer any questions or comments or concerns that you may have. So what I'm going to do now is I've had all lines on mute. I am going to unmute everyone. So please try and eliminate background noise as much as possible, or mute your phones manually. And we'll open it up to any questions. So all lines are now open. If you have a question, please feel free to ask it. You can also use the chat function on GoToMeeting if you want as well. Are there any questions? So one thing that we've heard from some of the individuals that we've talked to, or that we would like to, I guess, get some feedback from those of you on the call is, you know, where are you kind of at with your status in implementing OneRx? Have you begun to screen patients? If not, you know, what are some of the challenges that you're having to start screening those patients?
Hi, this is Rosemary at All True Retail Pharmacy. Can you hear me okay?
Yes.
Yeah, well, we haven't started screening yet, but we're still working on getting all our staff up to speed and getting our pharmacists trained on it. And we're almost there. I'd say we'd be able to probably go live next week. So that's where we're at.
That's great. That's awesome.
And this is Kyle up in Rugby. We're just getting our second pharmacist rolling on it here too. He's in the middle of getting the training started, hopefully in the next few days, and then I got some of the paperwork packets ready, and the technicians are actually wanting to listen to that 2-hour session for them too. So I think they're going to get that done here in the next few days to week, so we can get rolling on it a little better. So.
This is Jamie.
Excellent.
I'm calling from Thirsty White in Mandan. We've been implementing this for about a couple weeks now. So far, patients haven't been too, concerned about filling out extra paperwork. I've kind of explained to my staff it's kind of like if you have a patient fill out a VAR before a flu shot, it's just making sure that we're covering your, previous, or current health history and whatnot before we dispense something to you. One question I did have, though, is that we do have some patients' caregivers or family members that come pick them up. So, I was a little hesitant to have them fill out forms about the patient. But usually it's like if it's a caregiver, then I'm okay with, if they could fill it out to the best of their knowledge and just explain like why we're having them fill it out. Is that typically what anyone else has done too?
We talked about that at South Point and asked the OneRx team, and yeah, they agreed. They said if it's a family member, they probably know the patient well enough that they can fill out the form. You get the situation where you have somebody that got their wisdom teeth out, and it might be a roommate or somebody that's picking up the prescription with them, and so therefore at that point we probably were just checking PDMP and then determining if there's any risk there. But then we probably wouldn't have them fill it out if they don't know the patient that well. But family members definitely probably should be able to.
Okay, thank you.
This is Kyle again in Rugby. Amy, can you elaborate on what we were talking about with screening every patient versus, I mean, we got some of these people, like you say, in here every month. We're probably not going to do this every time, are we?
Yeah, I'm glad you brought that up. And I just wanted to mention that so far the two topics that we've brought up for discussion, the OneRx team has addressed in our FAQ section on the website. So you can go to the North Dakota Board of Pharmacy website, click on the OneRx link on the right-hand side, and you'll see the FAQs at the top of the OneRx page. And we've addressed both these questions there. But we really want you all to use your own judgment with your individual patients. We put some guidance there that if you have a patient who is chronically getting opioids, their dose has not changed, their prescription is the same as it's been for the last 6 months, and it's continuing that way in perpetuity perhaps, we're suggesting 3 to 6 month time frame that you have them repeat that, because there could be some of those factors that might change in that shorter period of time, but they're probably not going to change every month. And we don't want you to be, burning bridges with your patients, irritating them by having them complete the form every single time. So 3 to 6 months is kind of the guidance we're suggesting, and use your judgment within that time frame as far as how your relationship is with the patient and how that's going to go. I'm just going to do that on that regular basis.
And Mark Strand helped us out in chat. He put a link to the FAQ document as well. If you want, you can pull that up right out of chat.
Hi, this is Lauren. Can everyone hear me okay?
Yes.
Okay, I just had a quick question. I'm calling in from Belcourt, and we're in the very beginning stages of implementing this in our pharmacy. So I guess my question is this something that all of our pharmacists need to be trained on through the 1Rx program, or is this something that a couple of us can be trained and then train our entire staff?
That's a really good question. Really, there is no requirement for the number of pharmacists to be trained. As long as one pharmacist is trained in your pharmacy, that pharmacist can go ahead and operate as a 1Rx practitioner and enroll their pharmacy. The pilot research that we have done and collected has indicated that the more pharmacists that are trained, the more successful the pharmacy tends to be in implementing the workflow and making it a smooth process and a consistent interaction with their patients. The patients begin to learn what to expect and that sort of thing. But there is no minimum requirement. In order to be eligible to participate in our in our recognition program, it is required that you have half of your pharmacy staff trained. So that would be your pharmacists, not technicians. That's not part of the recognition program, but half of your pharmacists trained and participate.
And what was that program again?
The pharmacy recognition program. That's also something you can view on the North Dakota Board of Pharmacy 1Rx page. There's information about the different levels that we're recognizing pharmacies for their achievement in the 1Rx program.
Okay, all right, that sounds great. And now it's also my understanding that there are online trainings available now, not just the in-person trainings, in order to enroll?
Yep, that is correct. There's a 3-hour pharmacist online training accessible from that same website, and a 2-hour online technician training. And those are all available free of charge, and you can complete them basically at your own pace.
Okay, and where did you say I can locate those links? Is that also
if you go to the North Dakota Board of Pharmacy webpage, and then there's on the right-hand side of your screen, a green and yellow 1Rx button.
Sure, okay. All right, thank you.
You're welcome.
Along those lines right now, so if I'm trained and I get the workflow in place, but then I happen to be gone for a day or two, they can't do it then when I'm gone?
If they are trained, they could. Certainly, a relief pharmacist that comes in.
They would be trained by that point because I've got the workflow in place and they're all doing it. I mean, the opioid part, the pharmacist is a pharmacist. He's trained at this point. So that's why I was wondering. So in other words, you pretty much need everybody trained through this thing in order to run it all the time. Otherwise, it's just when you're there, right? If it's 50%. So.
Correct. Yep.
Okay, thanks.
This is Jenna from the South University Hospital Pharmacy at Sanford and Fargo. Amy, you probably be the best. Can you hear me all?
Yep.
Amy, you probably be the best one you kind of know our workflow at our pharmacy a little bit, but what could we do to not delay discharge? Most of our patients that we're going to be utilizing this program, we pretty much get the prescription, fill it, and then we have that med-to-bed program where we're delivering the meds to the room. And what we're struggling or what we're trying to brainstorm is how we won't delay discharge with this process.
So, Jenna, I think that you would probably have access to most of the information that's asked for in the screening tool from the patient's chart. on discharge when you get the discharge orders. So you could probably make a fairly informed decision about how they would screen out on the screening tool. And you could maybe leave unanswered questions for when you go up with the meds to the patient room, or maybe check with the patient's nurse if they have any of the information that you're missing. And I would think that having the naloxone already prepared and brought up to the room with you would be the easiest in terms of preventing hiccups or delays. That might mean a little bit additional workflow on the back end if the patient refuses the naloxone on discharge, that you'd have to bring that back down to the pharmacy and reverse it out. Anything
Okay.
I'm not thinking of?
No, that makes sense. Thank you.
Mm-hmm.
I've been looking at chat, and Lane shared an example from Oaks Family Pharmacy that you've got one tech and one pharmacist trained, and you started screening, and you got through about 4 to 5 patients, and you've been using the iPad. So that's really encouraging to hear. I can share that we have. I looked the other day, and I think about it was what did I say it was? It was 18% or so of the screenings thus far have been captured via the online patient intake form. So either using an iPad or the QR codes for their personal device. And then the other remaining percentage was via the paper process. I'm just curious, Lane, I appreciate sharing that comment. Is there anything else you'd like to add over the voice to your story?
Can you hear me?
Yes.
So I think that we've had a pretty successful implementation of the OneRx. We do have some patients that get their opioids every month. So
Oh, we might have lost you.
Lane.
We have had patients receive those prescriptions. I think it's been pretty successful overall.
Good to hear.
Thank you. Jeff, kind of along those lines too, I know that you said that you've started to use an iPad now as well. One of the questions that I have, is you have the iPad there for people to complete it. How do you know, or how have you worked it into your workflow to then on the back end look at REDCap to see their results and see that they've completed the intake form?
Okay, well, we have the iPad set up in our blood pressure station. And so it's actually just right to the left of where we're filling prescriptions. So as soon as we see the patient, they essentially will complete the iPad. They'll get up and move over to their chair to our waiting area. And so as soon as they get up, we know that they've completed it. So we have our computer set up probably 20 feet from there that we use for the REDCap. And we go right over there and complete our section of it.
Excellent.
Hi, this is Lauren again in Belcourt. Just to expand on that, so if you are using the electronic version, and I'm unfamiliar with this because we have not started it at this point, but how do you see what answers that they have answered on the intake form so that you know how to, I guess, offer the naloxone if needed or see how they screened out?
That's a really good question. I'm going to go back. So within the REDCap system, there's this thing called a record status dashboard, and you can go on there, and I know it's probably a little bit hard to see on the slide that's on the screen, but when you click on record status dashboard, it gives you a list of all of the screenings that have been entered in your system. And you've got one column for the patient intake form and one column for the outcomes worksheet, which is the document that the pharmacists need to complete to explain the types of interventions that you took and the results of the screening. So you should be able to see the person's name and then a green circle for their intake form. And you can actually click on that green circle and that will pull up their intake form so you can look at all of their responses if you want. Another thing that's happened though is that if you just click on the outcomes worksheet online within REDCap, we have it so that their ORT score automatically displays on that outcomes worksheet. So you can see what their score was. It also, when you click on the electronic outcomes worksheet, it will show any of the questions that were flagged. You know, so if they answered yes, that they were taking another medication that potentially increases their risk for overdose, that will show up on that outcomes worksheet. So really what we would recommend is when you get in, you click on that record status dashboard, you see that someone's completed the intake form. My next step would be to click on that outcomes worksheet to see those results and their scores, and then move on from there. Is that similar to your process, Jeff?
Yeah. We don't click on the first button there. We always click on the second one because it's scored it already for you. It's got all of the any problem areas that you have to hit, you know, that would fall under the questions they answer yes to. It's all right there for you. So it's really, it does speed up the process quite a bit.
Okay, thank you.
It's really easy to use.
This is Sarah from Thrifty Weight in Grand Forks. We've been doing the OneRx for probably a good month now, and have had a lot of success, you know, screening a lot of patients. One thing that I wish we could do more of, and I'd like to figure out a successful way to do this, is the partial filling. Especially when we get, you know, e-prescriptions where we're not screening the patient right at drop-off. It's very time consuming to say, hey, maybe let's wait 10 to 15 minutes again and we can put some of this back and you can only get, you know, this much. Has anybody figured out a way to do this really well?
Yeah, that's a great question. That is a problem because we highlight with the little OneRx business cards. We put that on the bag to, you know, notify that they are somebody that needs to fill out the forms. But yeah, for partial filling, it is, you have to go back and redo. It would be a good thing for us to talk about how to best approach that.
Sarah, thanks for bringing that question up. We're going to take it back to our team and discuss it some more with Jeff's input and maybe yours, and anybody else who has some thoughts about how you might work that into your workflow a little better, and see if we can come up with some potential solutions or ideas, and we'll put those out on the OneRx page and FAQ section.
Okay, and I know with a bunch of Medicare D changes for this next calendar year, a lot of them are going to be limiting day supplies on, you know, controlled substances, so it's kind of going to be forced for that. But
yeah,
even if there were clinical recommendations, you know, how many days would we recommend? Because it's kind of, you can choose a day, you could choose 4 days. I don't know.
Yep.
Thanks.
We've almost met our time here. Are there any other questions that anyone would like to ask this afternoon?
This is Jamie from Thrifty Weight in Mandan again. Another pharmacist at my store had asked, it hasn't happened yet, but he was just wondering, like, what if a patient or someone refuses to fill out the intake form? Should we still kind of go through like everything that we normally would if they had filled it out? Or do you want us to document any of that anywhere?
Have you had that experience, Jeff?
We have, but it only happened once. And what we did at the time was we checked PDMP and then just had to kind of use our professional judgment as to whether or not we were not. And for this patient, there really wasn't. So we just did our normal counseling and they went on their way. But that was just the one patient that's refused so far.
Yeah, I think as a 1RX team, what we would say is basically what Jeff did, use whatever information you have to perform an assessment. You will have less information most likely in order to be able to assess if there's risk for opioid use disorder, because that's, the bulk of the questions on the screening form get at that, but you would be able to still make some assessment about risk for overdose based on the opioid dose, the profile review, their other medications and DMP, and go from there. And you can't really document in REDCap if the screening tool is not complete, but really what we're going for, we want patients to get the care that they need, and the collection of the information is great, and that's, an important pillar of the 1RX program, but it's not the only pillar of the 1RX program, and the patient care needs to be at the forefront always. So.
Thank you. Hi, this is Lauren again in Belcourt. So I have one final question, I think. So I'm working at a federal facility, and not all of our pharmacists are licensed in North Dakota. Does that matter as far as obtaining this information and providing these services?
Not to our knowledge. We're all sitting here shaking our heads.
You're able to practice within your federal facility with your license from whatever state, and so that as long as you're able to practice within your facility, that should not be a barrier, correct, to participating.
My only question that maybe we should, and maybe Lauren, is since North Dakota has licensed pharmacists to prescribe naloxone, I don't know how the federal viewpoint would be about that. Do you, or if you would need a sort of standing agreement with the providers in your community?
Right. So I think we would probably just need to ensure that all of our state-specific pharmacists were also able to, prescribe naloxone.
Correct.
If that were the case. Okay.
Yep. That's a really good question. You guys are exercising our minds today. This is good. Well, this has been great. Greatly appreciate the questions that have been asked. They've been phenomenal. Appreciate your engagement in this call today. Want to remind everyone that next Thursday we are going to have another coaching call from 1 to 1:30 p.m. And this one's going to be focused more on clinical pearls. So this is going to be focused on, how you can interpret the different score results and items like that. So we hope that this call has helped you gain some insight into some of the operational issues involved with implementing 1RX. Encourage you to attend that as well. Please feel free to contact us with any questions that you may have. Our information is available on the slide there, and also on the 1RX webpage, which is housed by the Board of Pharmacy. This will conclude our coaching call. Thank you all so much for your participation today.